Just give me a little bit about your background.
So my background is I'm an adult infectious disease specialist. I trained here in Texas in internal medicine at Baylor College of Medicine, and then did specialty training in infectious diseases also at Baylor. Taught for a time up at the University of Nebraska, but have been back in Texas practicing in private practice since 2001.
Okay, perfect. And you've been instrumental in treating COVID-19 cases and doing research on that as well.
Yes, sir. At Methodist Dallas Medical Center, we've had a fair number of patients here, not only in our hospital, but our sister hospitals within the system. But definitely, we have been running clinical trials here for COVID, including the remdesivir trial.
Okay, and we talked about remdesivir maybe 2 days ago. So just talk to me. This is a sidebar, but just talk to me so far about that. Do you see that as does it really slim down the recovery time?
It does. In our hands, which is basically the protocol that was given to us by Gilead, the sponsor, we've seen that people tend to get better when they get the drug compared to those who don't get the drug by at least 4 days, maybe a little bit longer. Dr. Fauci reported on those results from a New England Journal article just about 2 or 3 weeks ago. So our experience has been the same there. What we've really been impressed with is that if we're able to start people before they get really, really sick, in other words, have to go to the intensive care unit and have to be on a breathing machine, in those situations, those patients can get better and go home before they even finish the course of therapy. Now, that doesn't happen all the time, but it certainly didn't happen at all before we had remdesivir. So for us, and in our estimation, it's been a game changer, and we've been very pleased with the preliminary results. We'll be eager to see what all the results are once they've been analyzed from all the study centers.
Absolutely. So we're working on a recovery method for that, and then something else springs up. This Kawasaki like this. I don't know if you call it a disease or if it's a syndrome. Just talk to me about what's going on with that.
So Kawasaki's disease or syndrome is a very well-known and a very old syndrome. It was first described in Japan in 1967, predominantly in children. And I've seen cases of it before, but I don't practice pediatrics now. We don't see Kawasaki's in adults typically. Kawasaki's is an inflammatory condition. We're not exactly sure what causes it. Some people have thought it was based on some kind of infection. Other people have thought it might be some toxin in the environment. Whatever it happens to be, it turns on a child's immune system, and it causes the immune system to attack different parts of the body, but probably the part of the body that's most at risk is the heart. And in those children, they can develop what are called aneurysms or ballooning of the coronary arteries, the arteries that supply the heart. And that can lead to heart attacks. And that's what people have been watching for. And actually, they're seeing in some of the patients that have been found to have Kawasaki's in different parts of the country during the COVID epidemic. So while we don't know what causes it, there is now a concern that there might be a link between COVID-19 and in children, Kawasaki's. We don't see that same manifestation in adults. And this link is not firm right now, but it certainly appears to be a little bit more than coincidental that we're seeing these two things at the same time.
Yeah. So are y'all finding? And I just want to know more about that link. Are y'all finding that adults with COVID-19, their kids are getting Kawasaki, or what's the link? Is a better question.
So that's a great question, and so in the Dallas-Fort Worth area, since we don't practice general pediatrics in our practice here, we're a transplant practice, but our colleagues at Children's Hospital and at Cook's Children's in Fort Worth, they have not seen an uptick in Kawasaki's. We're on a weekly call with all the infection prevention experts from all the hospitals in the region every week. And so our weekly call is typically on Wednesdays. And we've asked the last 3 weeks the pediatric colleagues to give us an update on what's going on with Kawasaki's. Because as adult physicians, we're not likely to have those children brought into our emergency room. They're going to go to Children's. And they've said that they really have not seen that yet. Now, they are embarking on an educational an educational event of sorts, and plan to try to let all the families know, particularly as you suggested, if there's a family member that has had COVID, letting the family members know what to look for in the children in that household. But as of right now, it seems to be very spotty in the country. A lot more cases up in the Northeast, a few in the West, different places in between. But we just have not seen that association here. So that's why it's not clear whether there is a cause and effect related to this, or whether it just happens to be coincidental. In the past, one of the things that has been implicated in Kawasaki's is deep cleaning. When people cleaned deep cleaned their carpets in particular, it was noted that when people did that, there seemed to be more cases of Kawasaki's that came from households where there had been some deep cleaning involved. Well, I think everybody is deep cleaning these days in some way, shape, or form, particularly in hospitals. So there is some concern that while this is going on at the same time COVID is going on, that the link to COVID may not actually be an infection link, but be linked to something that we're doing to try to prevent COVID. Again, this is all very preliminary, and there are still a lot of concerns that this may be an unusual manifestation in children of COVID infections. Some have been found to have it, but not all have been found to have COVID. So the link isn't very strong yet, but it's certainly enough to cause alarm. Make people, doctors, emergency rooms aware, as well as families who have a COVID member with children in there to make them aware of what to look for.
Absolutely. So it's safe to say you guys were really, really early in your research with the link.
We are throughout the entire country. They're definitely early in the epidemiologic association between this, but there's no doubt that anytime we see children get sick like this, a child coming into an emergency room with a heart attack, that is almost unheard of. But there have been several cases of that have been very notable around the country this year. And that is of concern to pediatricians, because that sets off an alarm that there may be something going on. And it could be COVID, but it could be something else as well. So a lot of work ongoing in that sphere.
So, I mean, is it too early to ask you the advice you give to parents? I know you're not in pediatric medicine, but the advice you would want to give to parents at this time as someone who focuses on disease.
Sure. What I've advised parents, our clients that are going home, and we have a lot more patients going home who have survived COVID now, and we're very pleased with that. This is true all over the city, quite honestly. But what we're advising our families to do is when they go home, whether they're grandparents, aunts, uncles, parents, is that they watch the children very carefully. And what we're asking them to watch for is fever, rash, and chest pain. Those are the things that we're worried about. Or if the child begins to act differently, acts tired for no reason at all, that might imply that the heart is starting to become inflamed. And that would be the time for the child to be evaluated very quickly. So I think our pediatricians are likely in the next 1 to 2 weeks, when I get on this weekly call with them, are likely going to be able to advise us better on what we should be doing as adult physicians, how we should be counseling our adult COVID patients when they go home. We still feel very strongly that we should try, a COVID adult needs to try to isolate him or herself away from other members of the household. And now we feel it's important that they do that, particularly with the children, because we don't know how strong this link is.
Absolutely. Absolutely. I think I got everything I had questions about answered. Is there anything else that you would want to add that you feel folks may need to know?
No, sir, I don't think so. This Kawasaki's is getting traction in the last 48 to 72 hours. So I have to laud you for being kind of on the front edge of that and educating people. I think it's really important, even though we don't have a strong association, and I don't usually raise alarms when we have as little association as we have right now. But these are uncertain times. This is not the time to sit back and wait and relax. This is the time to act, I think. And so when somebody is worried, contact their pediatrician, get that child evaluated, because early intervention can make all the difference.
Absolutely. My last question for you, how high up in the chain? Give me one. Sorry about that. How high up in the chain is this going as far as national attention, as far as all the way up to Dr. Fauci?
It's up there with Dr. Fauci. He is in non-public things that we receive, little newsletters and other types of medical journal-type articles and letters and correspondence that are circulated between the medical schools, between infectious disease groups, intensive care groups. We're starting to see Kawasaki appear more and more in those particular groups, in those particular letters, as more children are presenting with this, and as there's more concern that there may be a link. Now, as I said, a lot of the adult physicians are not likely going to be working on how that link is established, but I can guarantee you that Dr. Fauci doesn't distinguish between adult and children in his purview. He's looking at everybody, all citizens. And so he's going to be monitoring this, and it is on his radar. It's not clear how loud we should raise the alarms for the general public just yet. But we do want people to be aware, the COVID families, to be aware, to watch the children very carefully, and if there's anything unusual, to contact their pediatricians.
Thank you so much, sir. I appreciate it.